Welcome to Green Desert Recovery Proposal on behalf of international NGO Saves Lives in Maternal, Child Health and Nutrition Division. The Green Desert Recovery Proposal has identified project areas in health, water sanitation and nutrition. These projects are highlighted in this YouTube PowerPoint video. These projects will allow the community of Angalsi to recover now and into the future.
MCHND is focused on delivering a community-based response structured around the immediate needs as well as the long-term psychosocial aspects of recovery. Our objectives include but aren't specifically limited to identify immediate needs of recovery obtained by conducting research within the affected communities, to achieve sustainable food and water security, to provide communities with access to fundamental health services, to improve the well-being and mental health of communities impacted by the protracted drought, and to increase community resilience in the face of future disaster.
Water and sanitation are a critical part of Project Green Desert for MCHND. The region of Angalsi has experienced extreme climatic conditions with no significant rainfall received in the last 12 months. The long-range forecast continues to show no significant rainfall for the next 12 months. The current conditions and forecasts will leave the area in drought for the foreseeable future. Water in the area have been heavily reliant on surface water such as rivers, creeks and dams, which continue to be contaminated due to the poor sanitation practices of the villages. We need to act. We need a sustainable water solution. Water security is critical for the area of Angalsi. MCHND have engaged with residents, elders and other local NGOs in the area and have identified installation of water bores will improve the diversity of water sources. These bores will not be exposed to the evaporation risks such as the current surface water supplies. Through the engagement on the ground over the last 3 months, local residents have been identified and are willing to be trained in the use of water bore equipment and maintenance of small pumps. The pumps will lift the water to the surface on demand and be a sustainable water source for livestock, food production, sanitation and drinking water. To support the food security in the area, water tanks are proposed to be installed adjacent to the school market gardens. These tanks will also enable water to be captured from adjacent buildings and provide a secondary source for the water tanks. The level of contamination from poor sanitary practices is impacting the water supply quality. Installation of new toilet facilities will enable sustainable wastewater practices to be implemented, reducing the pollution of water supplies and reducing the number of diseases related to poor water quality. The new toilets will have designated male-female cubicles that have lockable doors. This will improve the security of females and other minority groups from the high prevalence of sexual assault, which is due to the lack of privacy of the current facilities. Lack of privacy means vulnerable villagers tend to use the facilities at night, which poses higher assault risks. Coupled with the toilets will be hand washing facilities that will complement an education campaign improving the hygiene for the villagers.
Communities with greater access to social and economic capital and greater capabilities in exchanging these resources are more likely to acquire resilience in the face of disaster. It is essential not just to provide capital for a community, but also to promote opportunities for cultural and civic engagement across the lifespan of a developing community, which has been shown to build resilience after a disaster event. Such engagement provides a sense of cultural identity for a community and a sense of belonging for the individual. MCHND intends to take a strength-based approach to assess the needs and aspirations of a community and deliver action based on these priorities. This gives people an opportunity to have a say in the design and implementation of the program, providing valuable insight into social and cultural aspects of the program. A critical step in providing key needs of a community is to research what interventions have shown to be effective. MCHND have surveyed key geographical communities and have listed the immediate needs of recovery. Critical needs such as health, nutrition, water and sanitation are essential to the well-being of a community. Supplementary to these, MCHND is focused on building quality relationships both with and within the community to ensure future development. The building back of a community takes time, and some resilience building efforts will continue for several years. Relational resources that are stable, supportive, and nurturing build trust within a community and are important in facilitating the development of competency skills required to move towards positive psychosocial outcomes, including mental health. MHNCD is focused on providing education and training to notable leaders of the community who will embrace the socio-ecological framework and shape their community with a mindset for preparedness and longevity.
MCHND has aligned with the Global Health Cluster as a means of organising coordination and cooperation among key stakeholders to facilitate joint strategic planning. As a Health Cluster partner, MCHND proposed to engage Communities Health Africa Trust, otherwise known as CHAT, as part of the Project Green Desert to achieve a combined goal of improved community health status.
Please find attached a link to the YouTube video of CHAT, which you can watch at your own leisure.
After substantial review, MCHND proposed that camel clinics and a motorbike ambulance will be suitable to provide communities with basic health services. These initiatives, combined with the other subsections of Project Green Desert, will collectively tackle the outlined critical health problems. MCHND are requesting $100,000 to facilitate 2 camel clinic circuits and 1 motorbike ambulance as a Phase 1 trial to be accomplished within 12 months. The engagement of CHAT is community and government-led, allowing MCHND to initiate the stand-down phase at the 12-month mark as part of an exit strategy where follow-on action will be identified and recommendations provided.
As a part of the recovery phase for MCHND, the Project Green Desert proposal for the community of Angalsi to provide and improve health, water, sanitation, nutritional food security in a group cluster initiative. Nutritional food is a vital component of the recovery phase to ensure all members of the community have affordable, safe, nutritious food to meet dietary needs and live a normal, active life. Establishing and developing a joint venture with the farming community, schools, small holdings in agricultural projects will improve food security and nutrition for the whole community. Funding will be required to develop the infrastructure and cluster coordination groups to build these community garden projects and programs. The school and community garden project will require ongoing monitoring and working alongside health, water and sanitation. Funding will be required so MCHND can develop the infrastructure and cluster coordination group to monitor the school community garden project. Slow Food is an organisation that will facilitate the school community garden project for €900 per garden. The Food and Agricultural Field School Platform program should be implemented into the school curriculum to support the community school garden program. Currently, the Food and Agricultural Organization of the United Nations operate a field school platform with excellent results. A review and monitoring of the project would be carried out 6 monthly intervals. By implementing a food insecurity experience scale survey, this would allow an evaluation of the current and ongoing needs of the school community agricultural garden program. School community garden projects would improve nutrition, reduce malnutrition and meet the United Nations goal of zero hunger around the world by 2030.
Project Green Desert will achieve the objectives of sustainable water, improved sanitation, improved community health, and nutritional food security. To achieve these objectives, MHNCD requests your support to partner by providing funding of $1.2 million US over the next 12 months to establish a sustainable legacy for the Angalsi region, which is under severe drought. The initiative will be locally led recovery, will have a clustered approach with other NGOs, and will provide sustainable outcomes. Please support. Do you have any questions?